Here is a healthy foot. For patients with diabetes, it is vital to understand the importance of good foot care. An annual comprehensive foot exam is recommended by the American Diabetes Association, the ADA, for patients with diabetes. More frequent examination by a specialist is recommended for high-risk patients. A foot assessment by a healthcare provider may be recommended at least every 3 months. Patients with diabetes have to take special care of their feet. Diabetes mellitus is a leading cause of peripheral neuropathy in the United States. Diabetes frequently leads to vasculitis, causing blood vessel walls to harden, thicken, and develop scar tissue, decreasing their diameter and impeding blood flow and oxygen supply to the peripheral nerves, leading to serious damage to or death of nerve tissues. About 60% to 70% of people with diabetes have mild to severe forms of nervous system damage. People with diabetes may be unaware of foot wounds or injuries. They are at increased risk of foot ulcerations and amputation. The lifetime risk of a person with diabetes developing a foot ulcer is 25%, more than 10 times the incidence among people without diabetes. Foot disease is the most common problem of diabetes, leading to hospitalization and amputation. After amputation, the chance of another amputation within 5 years is 50%. A comprehensive foot exam is recommended annually for patients with diabetes. With this exam, the patient's risk level can be identified. We will now go through the steps of a comprehensive foot exam for a patient with diabetes. Afterward, you will be given a chance to conduct a simulation of a foot exam. Step 1. Ask the patient if they have any history of foot problems, such as previous ulcerations, ingrown toenails, foot infections, or slow-healing wounds. Inspect the foot for deformities such as hammer or claw toe, bunions, Charcot foot, or any bony prominences. Assess the patient for altered biomechanics such as excessive pronation or supination, limited ankle dorsiflexion, or ankle weakness. If any of these deformities or altered biomechanics exists, the patient is at high risk of developing an ulcer. Check the toenails to see if they are ingrown, deformed, or fungal. Thick nails may indicate vascular or fungal disease. Examine the foot between the toes and from toe to heel. Check for sores, calluses, infections, fissures, cracks, and painful areas. Skin that is thin, fragile, shiny, and hairless is an indication of decreased vascular supply. Step 2. Conduct a vascular assessment by feeling for dorsalis pedis and posterior tibial arterial pulses on each foot. If one or more of the pulses is absent in either foot, the patient is at high risk of developing an ulcer. The dorsalis pedis pulse can be detected while palpating from the prominence of the navicular bone in a posterior lateral direction towards the lateral malleolus. The posterior tibial pulse can be palpated between the medial malleolus and the Achilles tendon. Step 3. Assess for protective sensation with a 10-gram monofilament. There are 9 points on the plantar surface and 1 on the dorsal surface of the foot to be tested. If there is no sensation on one or more of the tested sites, the patient is at high risk of developing an ulcer due to peripheral neuropathy. The assessment is abnormal if the patient cannot sense the touch of the monofilament when it is pressed against the foot with just enough pressure to bend the filament. Touch the monofilament to the metatarsal heads and the tips of all the toes on the plantar surface of the patient's foot. Touch the monofilament to the dorsal surface of the foot at the midfoot. Avoid scars, ulcers, necrotic tissue, calluses, and corns which are not sensitive. Early recognition and management of foot ulcer risk can prevent or delay adverse outcomes. Patients with diabetes and high-risk foot conditions should be educated regarding their risk factors and appropriate self-examination. On the back of the image you are holding is a diabetes foot screen examination checklist. You may make a copy, use this checklist during a comprehensive foot exam, and keep a copy in the patient's chart. An annual comprehensive foot exam is recommended by the ADA for patients with diabetes. More frequent examination by a specialist is recommended for high-risk patients, and patients should be encouraged to do their own daily foot care. For your patients with diabetes, consider giving them the Foot Care Fact Sheet. Your Novo Nordisk diabetes educator can provide a copy. For people with diabetes, it is vital to understand the importance of good foot care.